This is E! News Primetime. Good evening. The South African government has pledged to help with the growing cholera crisis in Limpopo.
Cholera is a common waterborne disease. It can be deadly, but it is easily cured. My name is Dr. Welile Shasha. I'm a public health specialist, and I was contracted by HLSP to assist the National Department of Health with control of cholera in 2 provinces of South Africa. In December, I moved on to Musina, where the disease was a disaster. The hospitals were overburdened by cholera. My main job was, firstly, to provide liaison between important stakeholders, and secondly, to provide support to health workers in their control of cholera at clinical and also at community level. After the cholera had abated a bit there, I was asked to go to Mpumalanga, where it was increasing rapidly. 2 members of this family nearly lost their lives in the outbreak.
At the same day,
Charles Nobela told me how he and his granddaughter both ended up in the local hospital. Little Kuwela got so ill, her eyes rolled back as if she was dying. The hospital put her on a drip and she gradually got better. It took a while before she was discharged.
The 2008-2009 cholera outbreak caught the department unaware because we hadn't had cholera for some time. And because nobody expected it at the time, we lost a number of lives on the early days. But later on, with the technical support that was appointed by the National Department to the province in Dr. Shasha, we managed to train people, get awareness campaigns going, and we kept the numbers.
I'm coming here today to Poland Sigazi to find out from the health workers how things are going now, whether there are still any patients, and so on.
On the 31st of March 2009 is where we saw the last patients and declared cholera ward closed.
Why do you think the cholera went away?
You know, we had a lot of lectures. We were taught how to take care of people who have got cholera, suspected cholera like diarrhea.
People were now educated, people were now aware. The numbers of people who were having diarrhea reduced bit by bit.
Well, now that the outbreak of cholera has been mitigated, we need to look deep into the causes of it, why it came about. If we just leave it, then it's going to occur again. And there are 2 important things to look at regarding the outbreak. First one is access to clean drinking water. The second one is the issue of sanitation, particularly in rural areas. Regarding sanitation, an important element of that is the sewage plants that clean the water, because legally the water needs to go back to the rivers clean. The majority of sewage plants, especially in rural areas, are not working well. They are grossly overloaded. As a result, the water getting into the rivers is not clean. The hospitals is where patients with cholera are admitted. And if the sewage plants draining those hospitals also discharge into rivers without cleaning the water to an adequate level of cleanliness, then that is a problem. As regards sanitation at community level, it is very important for people to have well-constructed pit latrines, in the sense that they should be properly ventilated so that they can prevent flies from spreading cholera. This is the type of toilet that spreads cholera. But I'll show you something else. That toilet is right at the edge of this river. The water from that toilet seeps down to the river with all the muck, and that is dangerous for health.
What makes it difficult in a province like ours to deal with a disease like cholera is the fact that the socio-economic setup in the province is such that the infrastructure is not there. The sanitation infrastructure and access to water is still very limited, and therefore many water sources get easily contaminated, and then controlling the outbreak becomes difficult. There are recommendations that have come through Dr. Shasha, and these are a subject for discussion. In terms of these recommendations, the issue of sanitation and access to safe drinking water has been made a priority to ensure that future outbreaks are prevented.